Well, good afternoon, Darlington County School District stakeholders, staff, parents, and students. Welcome to another Facebook Live. It has been a while since we've had a chance to be together in this format. I believe this is our first Tuesday, actually, that we have ever done a Facebook Live. So our plan was to do one this past Friday, but we wanted to wait until we had our board meeting last night so we could add in any of the information that was discussed at the board meeting. As well as be able to give information that we have currently and be able to answer questions that have been submitted. We had people that have been submitting questions over the past couple days. So again, good to be back with you. We are trying to stay connected when we're actually not connected in our buildings right now. Obviously, we are out for e-learning as we speak. We'll talk a little bit about that as well through the next hour or so. So again, glad to be here. And hopefully we'll be able to give you some information that will help you and answer some questions that you have as well. I always like to start off our Facebook Live with a word of the week. And so as I was looking through and thinking about the past few months that we've been dealing with, almost a year now that we've been dealing with our current circumstances, the word came to mind of endurance. And so endurance, the definition is the fact or power of enduring an unpleasant or difficult process or situation without giving way. And I think that's very appropriate for what we're in the middle of right now. We are in an unpleasant and difficult process as we work through the pandemic, amongst other things that we're dealing with. But we're not giving way because we are trying to do the absolute best that we can for our students, for our staff and teachers, and for our families and communities. So trying to embrace everybody and bring them in and take care of everybody as much as we can at this point in time with a lot of uncertainty and unknowns, unfortunately. So I wanted to start off with our current state of the district and the decisions that we're in the midst of making. And I also think it's appropriate given the state of things over the past few weeks, not just in our school district in Darlington County, but in our state and in our country. And one of the things I really want to be able to message to everybody is that this is not a time for us to be pulling apart from each other and to be divided. This is a time to be united. We are all focused on our main point, which is our students. The Darlington County School District exists to educate students. And of course there's our staff and our teachers and everybody else is part of that whole process, but ultimately this comes down to kids. And I've said that repeatedly over and over, but I just want to make sure that during these uncertain times, look, we're not always going to agree with each other. You may not agree with the decisions that I make. Some decisions I make, some people will agree with and some don't. And I know that that's always the way it's going to be, especially in times of uncertainty. But let's at least respect each other for trying to do what the right thing is. And we're all after the same goal, which is to take care of our kids and to help them as much as possible. So if we know that going in, I may not necessarily agree with everything that you may say, but I certainly respect you and certainly respect your point of views and certainly respect where your place is with children. And so, unfortunately, there's a bunch of right and wrong answers right now. There is not just one right answer for anything that we're discussing. That's what's made this so difficult as we go through the weeks and trying to figure out exactly what the next steps are. So please know, let's have respect and civil discourse towards each other. It's fine to disagree. We should be able to disagree. But let's do it respectfully, and let's know that we all have the best interest of our kids at heart. We're just trying to do the right thing, whatever right is. And again, there's no real clear definition of what right is today. in the midst of a pandemic, and as we try to make decisions, and as the variables and the data and the facts keep changing on us as well, and the responses to those variables and facts. So again, these are not just school COVID issues. These are more society questions that we're dealing with right now, because even though we may be making decisions about the Darlington County School District and our schools, the reality is there's a much bigger picture that we're having to work within. And if we do not look at those other society issues that we're dealing with right now, while we make the decisions for our schools, we're going to have some blind spots, and we need to be careful about that. So again, I wish I could say that I was just making decisions about a new program we were starting this year, or what time we were going to have graduation. I long for the times where I can make those decisions instead of the types of decisions that I'm having to make right now, and we're having to make as a district and a board, as far as do we stay in school or do we not stay in school, and what is considered safe and what is not considered safe. Those are very difficult questions and answers compared to here's what time we're going to have graduation this year. So again, just please know that we're doing the best that we can. We absolutely value and care for our staff and our teachers. We value and care about our families and our students. We care about our stakeholders, our businesses that are out there, our churches. All of these things are impacted by decisions that the school district makes, and vice versa. And so just know that everybody deserves a seat at the table, and everybody has a right for their voice to be heard. And we're just trying to do the best that we can to pull all of that together into a space, and to be able to make decisions, the best decisions that we can make at that moment, given the information that we have. And so just know, again, decisions like, how will we return next week? What does next week look like? That's one of the big things that we're looking at currently. Our board met last night, and we had some of these same conversations. If you were with us last night, I'll try to dig in a little bit deeper. And if you weren't with us, I'll try to, again, relay the information that we discussed. And so one of the things that the board did make a decision on last night, and they voted unanimously to continue the COVID emergency leave that was put out originally this past year. That expired at the end of December. And so our board, I recommended, and our board unanimously voted to extend our emergency COVID leave, which allows our employees to have up to 80 hours of extra leave if they are impacted by quarantine or by isolation. Again, this is an extension of what was already in place. It doesn't give additional hours, but again, anybody that has not had to use all of their 80 hours, we're extending it so there is time to be able to utilize that for at least the next 6 months, if not longer, or until the government decides to extend that. So that's one of the things that was discussed and decided last night at the board meeting. And then, of course, the other thing that we discussed is how will we return next week. And I know one of the questions that a lot of people have is, why are we waiting to make decisions? So, for example, why didn't we make a decision last night about next week? And I think the reality of this pandemic is that every day, every hour, truthfully, holds information that we need in order to make the decisions that we're trying to make. It used to be really easy to have information to make a decision for a month down the road. It was certainly even easy to make decisions for a week down the road. Now it's incredibly difficult to make even decisions a day or two down the road. And so, number one, I apologize to our parents and to our staff about sometimes how long we may wait to make a decision, and we certainly will try to again make these decisions with enough time to be able for people to be able to react appropriately for childcare or anything else that's going on. But just know it's not because we don't want to make a decision or we don't know how to make a decision. We're actually waiting to have as much information as possible to make that decision. Right now, the daily counts at the state and county, our school levels, are incredibly important. And each day, that makes a big difference in what we're looking at. So, for example, the state numbers, total positive numbers in the state, have been trending down for the past 4 days. I would want to see if they continue to trend down over the next couple days to feel better about making a decision for next week. So again, 4 days, that's great, but I'd like more days to see what that trend looks like, and possibly if that changes. And so just know we're not in paralysis. That's not the reason why we're waiting. We're trying to have all the information possible to make the decision. Please know that I believe the best place for our students to be is in school right now. And if there's any way that we can safely put kids in school along with our employees, I'm always going to wait to make that decision if that's a possibility. If it's not a possibility, then we'll certainly make decisions sooner. But the focus that I have on the decision process is ultimately our students need to be in our buildings. I believe that's the best way to educate them. I know we have a lot of students that are doing virtual academy, and I know that we're in e-learning right now, but ultimately I believe the best offerings for our students is in a face-to-face manner. And so I'm doing everything possible to make that happen, as long as we can safely and confidently do that. So again, we should have an answer within the next couple days about next week. My intent right now is to be back in school next Tuesday. So that is what we said when we made the decision to have the first 2 weeks after winter break to be e-learning. We checked with a lot of different people to make that decision. We talked to our medical field folks. We talked to our hospitals. We've talked to doctors. We've talked to many different people, employees, of course, board members, just a lot of different folks to make the decision about how we should have come back after winter break. And in the end, we decided to wait and do e-learning for 2 weeks to see if that would help with the spread that everybody expected from the Christmas and New Year's holidays. And so that was our intent, is to, okay, let's wait for 2 weeks. And anybody that may have been exposed, that will have come to light and worked its way through. And so when we start back on the 19th, that should have given us at least 2 to 2.5 weeks to clear out as much as possible to have our employees back that will be taking care of our students, and of course our students back as well. So the intent as of today is to be back in school next week. Now, that'll depend on the data that we get over the next couple days. So we will certainly look at that and continue to monitor that. And then as far as the data, I know, again, I've had a lot of folks ask questions about, well, what data am I looking at right now? And it appears that I've changed the data that I looked at 4 months ago versus what I look at today. And why is there a change? Why was I focused on one set of data 4 months or 6 months ago, and I'm focused on a different set of data today? And so I would like to try to address that. And the main reason is that this whole process has evolved, and how we've reacted to the pandemic as a society has evolved. And so we're in a very different space than we were last March, in the middle of March, when our governor closed all of our schools and all of our businesses, except for essential frontline workers, in order to try to mitigate the spread, which at that time we were hovering around 200 cases a day. And so if you think about how things have changed and how we as a society has functioned over the past 9 months and how we've evolved, that is why the data change has evolved as well. And so, for example, every school district in the state was very focused on the DHEC spread by county numbers because that's what we were told to focus on at one point in time from the Accelerate ED group. And again, they were reacting to information they had at that time. And I think what's changed is, number one, what is realistically possible for us to exist as a society, meaning businesses open, schools open, people grocery shopping, people being able to get their cars serviced, those normal tasks that we go through in life, everybody seems to be a lot more comfortable with now than what they were back in March, for example. And I think that has to do with we've evolved. We've figured out what we can and can't do. Same thing has happened in our schools. We've figured out what we can do and not do from a safety standpoint. And so the numbers I'm specifically focused on, where I was focused on the state numbers at one time, as we all were, and then I became very focused on Darlington County numbers. Well, the reality is we've all learned to be focused on our organization numbers, because our organization could be drastically different than what the county and the state is looking like as far as the spread and positive numbers. So we are focused right now in Darlington County School District on the district numbers and on the school numbers. And we're focused on student numbers and we're focused on employee numbers. But obviously employees are a big part of that conversation, because if we don't have employees to serve the students that are in the buildings, we can't have students. And so regardless of the amount of students that are able to attend, if we don't have a teacher in a classroom, for example, or a substitute to be able to serve in that classroom, then we have an issue. And so the numbers I have been focused on over the past several months now have been related to the actual spread in our buildings. And again, I think what we've realized, as well as other school districts around the state have realized, is to not focus on the district as a whole, but individual schools. And so, for example, it wouldn't make sense if we had one elementary school that had 20% of their staff unavailable, which in my mind would not allow us to conduct business at that school in a face-to-face manner. We would need to be virtual then. It wouldn't make sense if that one school was impacted that way, but the rest of the schools in the district were not, and we shut the whole district down. Again, this is evolving. These are pieces of information and facts that every superintendent and every school board has been dealing with, and they've adapted to the information that's available. So again, from a number standpoint, what's important to me is that we have the realistic amount of adults in a building to cover and take care of our students that are in that building. And if we don't, then that's an unsafe situation, and I would absolutely want that building in particular to be on an e-learning process. Fortunately for us in Darlington County School District, we have not had to have a school that has been put on e-learning because of a lack of staff. In fact, we've had very few classrooms in Darlington County School District that we've had to put on virtual because a classroom has had too many people that we're not able to serve. Our biggest issues have been with our special education classrooms, specifically our self-contained special ed classrooms, where there's a lot of close contact with our teaching assistants and our teachers and our students and some of our therapists that we have. So we've certainly noticed a higher incident rate in those classrooms than we have in regular classrooms. and we've had very few classrooms that we have had to have out for e-learning purposes. We have had a lot of situations where we may have had a teacher that was having to quarantine or isolate, and they actually were able to teach virtually back to the school. So the students were actually in school in the classroom, and our teachers were able to teach back with another adult in the classroom watching our kids, of course, and continue instruction. So we've tried to work through as many ways as possible. Again, we're fortunate we've not had to close a school or put a school completely on e-learning, and we expect that trend to continue for us. Again, the numbers that we talk about as well. The numbers that I talk about in the meeting, for example, last night I was talking about daily positive rates that we have seen across the district. And so, for example, last night I talked about that we had 3 positives in the school district with employees. That was actually as of 5 o'clock last night as I was preparing for the board meeting. And so after the board meeting, I received another positive from one of our school principals that was letting us know about a teacher that tested positive. And then there were actually 2 that were in quarantine from a few days ago that became positive rates. So again, it evolves. It at that moment in time when I'm talking about numbers, it's the information that I have in front of me. So we went from 3 employees in the district before the board meeting to 6 employees in the district after the board meeting. And that happens on a regular basis. Again, we are going off of self-reported incidents with students and with teachers. So when our dashboard that we have for the Darlington County School District is populated when we are informed by people self-reporting. And so, for example, an employee calls their principal and says that they have to quarantine because a member in their household has tested positive. We document that information. Or if an employee calls and says, I've just got my test results back, I took a test 2 days ago, I tested positive. So we actually put that information on our website, on our portal, the day that we receive the information. So for example, if an employee has a test that they take 3 days ago, but they call today and say, I just got my test results back, I'm positive, that goes into our portal today as one of today's numbers. Regardless of when they took the test or when they had symptoms or how long they've been out of the building, we always go with the positive case the day that it is reported to us. And that goes, again, for staff and teachers as well as our students. When parents call us and tell us that their student, their child in their household is tested positive, that's the day that it goes on our website. Of course, since there are no students in our schools this week and last week, we're not reporting student incidents right now because they don't impact the building right now. And so we are reporting our staff still. So every time we are alerted to a staff member that tests positive, that is put on our portal as it comes to us. So again, it's incredibly important that for our employees that, number one, if you don't feel well, stay home, and please get tested. And number two, when you get your results from your test, whether they be positive or negative, that you communicate with your principal or your department head. And of course, we also have our benefits and HR folks that are involved with that, so we can make sure we get leave taken care of. So again, when I refer to numbers about positive cases, like I did last night in the board meeting, it's the numbers that have been reported to us when an employee or staff member, teacher, calls, emails, and lets us know that they've received a positive test. We are not tracking quarantines at this point in time on our portal system, but we are tracking quarantines internally because a quarantine, of course, is somebody that's not there. So just like a positive case is in isolation and that person is not in the building, the same thing with quarantines. Excuse me. So again, we are tracking the quarantines because that's important to know the overall picture for a building. For example, if we have 2 teachers that are out that tested positive, but we also have 4 other teachers out that are in quarantine, that's 6 teachers that are out of that building, not just 2 that are positive that we track. So we're keeping an eye on all that. We factor that into our decisions that we're making. And again, as we make these decisions, I think if you look around the country and you look around the state, hospital systems are involved in these conversations. And so when you, for example, if you look at the 2 largest, I would say probably the 3 largest school districts in the state, which is the Greenville school system, the Charleston school system, and the Beaufort school system, all of those districts are making their decisions with their hospital systems giving input. And of course, all 3 of those districts are open face-to-face. So again, these are not decisions that are being made in isolation or without input. Hospital systems and doctors, medical practitioners are definitely having a say in this. Again, we may not all agree with what those decisions are or what those hospital systems may be saying, but nevertheless, it is information that is being utilized as we are utilizing that same information to make decisions about whether we're in school or whether we're not in school and what the impact may look like. The next topic I wanted to discuss was the vaccine. And I know a lot of questions have come up about the vaccine. We discussed that in our board meeting last night. And all, what I'd like to be able to say about the vaccine is, number one, every doctor that I have talked to said it is our only hope out of the pandemic that we're in the midst of. That the vaccine and the vast majority of people taking the vaccine is our true only way out of the pandemic that we're currently in. And so there's hope that now we have the vaccine and it's started to deliver, and our frontline workers have started to receive those vaccines. And so I'm encouraged for our people who are taking care of the sickest of our stakeholders and our community members in our hospital systems right now, that they're getting vaccinated, and that there's hope that they don't have to worry about getting sick themselves and their families getting sick as well. So just know that I'm incredibly encouraged by the fact that we have a vaccine now, but I'm also being realistic about how the rollout of the vaccine has gone so far. Yes, we have the vaccine, and yes, there'll be a time where we all have access to it, but when that time is anybody's best guess right now. And so I have had meetings with state level officials as well as DHEC and conversations with hospital systems as well about the rollout of the vaccine. And again, there's just some uncertainty around about when. The if is definitely there. The if will happen, but the when is the big question mark. And so a lot of people have been throwing timelines out there, and I would just urge everybody to wait until we have solid, concrete information that we can give out to our employees and our communities and family members about the vaccines that we can confidently put out there and know is accurate information. So again, we hope to be able to get more information. I'm being told at the state level that superintendents should receive more information by the end of this week about a potential timeline. I believe we all know that the 1A workers, which are the frontline workers, primarily healthcare folks, that they all have to be addressed first. And our governor certainly put a timeline out there for our 1A folks to get the vaccine, and a lot of people have reacted to that over the past few days. But again, we know that they will not start 1B until they are confident that they've offered 1A to a very large amount of folks that are in need of it. So with that said, again, hospital systems around the state have been in contact with school districts that they're awaiting word on this. School districts are having internal conversations about what that will look like and how that rollout would look like for their employees. But we're all just waiting for the when and how that will look from a time standpoint. So, I will say, let me give you an example. Again, Charleston, the Charleston County School District, MUSC in Charleston, one of the biggest healthcare providers in the state, is working hand in hand with the school district down there. And so the school district is prepared for letting their employees know. The hospital system is prepared to be able to set a schedule up to give those vaccines, but the reality is there's no timeline on when that will happen yet, and that comes from the state level. So we again are waiting from our state level health and medical practitioners to give us guidance. As soon as we receive it, we'll be passing that information along to our employees and what the next steps are to be able to be vaccinated. So again, there's hope and there's a light at the end of the tunnel, because we do have a vaccine that they say is 95% effective. And once we can start getting our teachers vaccinated, I know I will feel so much better about all of our employees being in our buildings when we have the opportunity to be vaccinated, along with our children that have medical needs and their families that have medical needs as well, that are medically fragile. So stay tuned. As soon as we receive it, as soon as we receive the information, we certainly will be in touch with you about next steps. The next item that I would like to discuss is, and we talked again a little bit about this last night in the board meeting, is what happens for second semester. And specifically what happens for second semester for all of the families that signed up to move their mode of instruction. And so, as you'll recall, back before the Christmas holidays, we actually had a window that was open that we messaged, we made phone calls, we had it posted to social media and our website, we sent emails, we sent messages over and over and over back before the Christmas holiday that if there was a family and student that was looking to change their mode of instruction, that they could do that, and that they would need to sign up on the list so we could start putting our numbers together. And so that, of course, that was open for several weeks that was messaged. And then when that closed is when our schools started putting together their schedules. So at that time we had approximately 1,000 students that were wanting to move from the virtual academy back into face-to-face, and approximately 300 students that wanted to move from face-to-face to the virtual academy. And so in order to work out that 1,000 movement and the 300 movement back, that is a very large jigsaw puzzle that our schools have to put together. They need the time to take care of that. And the alignment of our teachers and how they actually are able to teach our students in those different environments. Obviously, if we have a net gain of 700 students moving to face-to-face instruction, that also shifts our resources and shifts our instructional resources as well as some of our other resources. And so that takes time to put together. And we have to align that for the students and families that signed up for that. So currently all of the schools have been putting that together. I believe every school sent out, again, calls, making sure that, hey, we have your application where you signed up to move from one mode of instruction to the other, and we are just making sure that you still want to do that. And if you don't want to do that, to let us know. And so all those calls also were made over the holidays and when we got back. And so we are piecing together the schedules for second semester. And so we will be accommodating those 700 students net gain to face-to-face, as well as the folks that chose to move from face-to-face to virtual academy. We will be accommodating all those. We'll be making phone calls towards the end of this month. Of course, the high school semester ends at the very end of this month, and the semester break for elementary schools and middle schools ends the first week of February. So we will be notifying everybody several weeks before those dates that the schedules are in place and that we will be able to accommodate. Now, the bigger question that's going to be difficult to accommodate is the 5 days a week for middle schools and high schools. Again, I've said over and over and over, I believe the best way to teach the majority of our students is in a face-to-face environment, and I believe 5 days a week, that as many days a week as we can get face-to-face is better for students. And I would, I would gather to say that our teachers feel the same way. If we're in a safe environment, if we would rather have 5 days face-to-face or 2 days and 2 virtual days, most teachers are going to tell you, give them to me face-to-face, because I know I can impact them on a daily basis if I'm able to have that time. So again, our focus is trying to find a way to get back 5 days face-to-face, not only with our elementary schools like we are now, but also with our middle and high schools. And again, but that's a difficult decision right now, and it's one that we're not able to make today. So I cannot say today how we will be starting back second semester, as far as will we be 5 days a week or will we be AB schedules. We'll have to have more information. We'll have to have at least a couple more weeks of information to be able to make that decision. But again, we will watch, we will gather, and at the end of the day, the board and myself, the administration, will make a decision on what that looks like for second semester. Once we are able to go back 5 days a week in middle schools and high schools, no, there'll be some changes. So again, per DHEC regulations and recommendations, they are recommending that if we have rooms with large amounts of students, that either A, they have to be 6 feet away from each other, or B, you have to have a barrier and 3 feet away from each other wearing masks. So again, DHEC and at the health professionals at DHEC at the state level have said those are one and the same as how they view the safety and the spread of the virus. So again, our students either need to be 6 feet apart from each other, or they need to be at least 3 feet apart from each other with some type of barrier and wearing masks in order to be in the classroom and not be considered a close contact if somebody tests positive in a classroom. So districts have done many different things about these barriers, and we have, again, we've watched, we've gathered a lot of information and gathered a lot of facts, and we have put together what we think is best for the Darlington County School District. Again, I can't speak to what other school districts are doing and the decisions that they're making, whether they're in school or not in school, whether they're in school 5 days a week or not in school 5 days a week. I can only speak to the Darlington County School District and what we believe is right for us given the current circumstances and for our students and teachers and staff. And so we believe that we do need to have some type of barrier, but it does not necessarily need to be very heavy plexiglass booths that surround every single desk. We believe that, again, the options that DHEC has approved and has said will serve the purpose of being a valid barrier 3 feet apart from each other is a trifold system that we can put on each desk, or a trifold that we can put on tables, and so that is the way that we will approach being able to keep people 3 feet apart from each other. with these trifold barriers. Again, they will be attached to each desk, but not permanently. So we will, when the time comes and we don't have to have barriers, it will be easy for us to eliminate those, and again, not have warehouse after warehouse full of plexiglass. So again, we want it to be as unobstructed as possible for the student and for the teacher, but also safe, meaning that DHEC has approved it, and that it will work as keeping people from having to be close contacts. And then last but not least, when we have to dispose of it at some point in time in the future, that it is, again, recyclable and something that can be taken care of pretty quickly. So again, just like school has looked different when we started, it's going to look different when we get back 5 days face-to-face in our high schools and middle schools. But if that's what it takes in order for all of us to be together at the same time, I think you all would agree with me, that's what we need to do. We know it's temporary. We know we will not always be in this space. And we know we will be past this at some point in time. So let's do everything we can to be as safe as possible, but also to have as many of us together as safe as possible, and be able to educate our students. Again, we'll make that decision within the next week to 2 weeks about how we start second semester. One of the things that, of course, we are looking at, if we start back in an A-B mode for high schools and middle schools, we certainly are discussing adding Fridays to that mix. And what we discussed at the board meeting last night, of course, is not necessarily a rolling A-B day. It would be a set A-B day for students. So a student would have a Monday, Wednesday, or Tuesday, Thursday, but then we would alternate the Friday for the A-B students, and that would alternate every other week. So we would still stick with Monday, Wednesday, Tuesday, Thursday, but the Friday would either be an A group or a B group, and we are certainly looking at that if we have to start back in the A-B manner. Again, we've talked to a lot of people about this. I know exactly how our high school and middle school teachers feel about Fridays right now. That's why we have been off for Fridays for so long. And so I certainly understand the concerns that our teachers have about keeping Fridays. That's all being discussed with the board and internally with administration. But also we're having to balance out how much instruction can we give face-to-face to our students. And so again, it's difficult, and it's a difficult decision to make. And so again, I know, we have teachers say, well, nobody's asking us and nobody knows how we feel. We are hearing from teachers and we know how they feel. And we are reaching out to different groups of teachers. And we will continue to do that. And so, a lot of times it's a teacher may say, well, they haven't listened to me, but we've listened to other teachers who say the exact same thing that teacher may be saying. And so, we are trying to get input, but again, it has to be everybody's input. It has to be our teachers, it has to be our parents, our students, our board members, our stakeholders in the community, and of course our administrators. And so all of that has to be taken in and considered when we make decisions. And I think it would be really unfair to say, well, this group holds more weight than this group, or this group holds more weight than this group. I think we have to be really careful and just know that everybody has a seat at the table. Everybody has a viewpoint that they add to the conversation. We take all of those views and at the end of the day come away with the decision that we think is best at that moment. And again, I applaud the board and how they've worked through all this. This is not an easy job. It's not an easy job for a superintendent. It's not an easy job for board members. It's not an easy job for teachers or anybody else. This is not what we were wired to do. This is not what it was set up to be a year ago. But the reality is that this is where we are. And so regardless of it being a difficult job, Our board has, again, researched and listened and talked to people. We have worked together collaboratively to try to come up with the best decision that we possibly can for the Darlington County School District. Again, that may be a different decision from a neighboring district. It may be a different decision from an upstate district or a district on the coast, but it's the right decisions that we're making for the Darlington County School District based on the information that we have. So again, I would just ask that that you can continue to talk with anybody that you can to let them know how you feel about things. And so if it's a teacher or a staff member, please talk with your principals. Let them know. Contact us. You know, we're trying to get input as much as we can. Parents, please, you know, again, talk with your schools, talk with your teachers. Let them know how things are going for you. I'm aware of many things that people are having difficulties with, and we're trying to correct as many of those as we can as they come up. But with that said, I'm going to go ahead and address a few questions that have come in over the past couple days, and hopefully this will answer questions that many of y'all may have had. And if we have time, we'll take some questions from online if we have a few minutes left to be able to accept some of those. But so this is a big question. How about sports? Where do we stand with sports and what we're doing with that? And you know, I always start off with it's complicated. So sports are complicated for us right now. Winter sports have been very, very difficult for us. Basketball, wrestling, cheerleading, you name it. It's just been hard for us to get any momentum moving forward with our teams. And so we've had a lot of quarantines, and we've had to stop and go, Currently, right now, you know, none of our sports are able to have practices or any type of competitions right now. And at this point in time, those are delayed until the 19th. And again, our intention today is to be able to restart those. I will tell you, I have great concerns about starting and stopping and putting people in quarantine for 2 weeks or 10 days. And then they come back and one person tests positive and they're back out for another 10 days, the whole team. And then they come back and they're back out again for another 10 days. I have great concerns, as well as superintendents across the state have the same concerns. You know, you're seeing colleges having to postpone and cancel games because of COVID. You're seeing professional basketball teams having to do the same, and they all have many more resources to mitigate than we do. And so I'm very concerned. I'm willing to try it. But I can tell you, I'm not in favor of a student missing 4 to 6 weeks worth of face-to-face instruction because they've been in quarantine because a team member has tested positive 3 different times. So we got to figure out how to balance that. So I'm hoping we have better results when we start back. We're certainly going to give it a shot. But then there's also the issue of spring sports, and spring sports took the hit last year. When we went out in the middle of March, all spring sports stopped, and so those athletes were not able to participate. And so I'm very aware of that those athletes, the spring sports, if we can make that happen, we need to make sure we make that happen for those teams, because it didn't happen last year for them. And so we got to be careful about letting winter sports continue and bleed over into spring sports and take more time away from them, because they've already had their time taken away from them. So we're trying to weigh all that out as well. And I know there's conversations at the state level asking about extending seasons. I don't know where that'll go. Again, there's two sides to that. You extend the season, you give them a chance to play longer, but you extend the season and you cut spring sports for 2 weeks, and you shorten their season. So again, difficult decisions to make. It's complicated. But right now we're set to start back on the 19th with our practices, and hopefully be able to get competition shortly after that as well. Another question that has been asked, and this is, again, kind of re-emphasizing what we're looking. Are we concerned about the increase in numbers and exposing our kids if they return? We absolutely are. This keeps me up at night. It's pretty much in my thoughts every minute that I sit in this chair and do this job. I'm always thinking about our students and our teachers and our staff and the impact that this pandemic is having on us right now. There's not a moment that doesn't go by that I don't think about those things and what is the best answer to take care of everybody. The problem is there's no one answer. And so that's what makes my job very difficult, but also the board's job too. There's not one answer that fixes all of the questions and how to take care of everybody at the same time. All we can do is gather the facts that we have, gather the data that we have, look at the Darlington County School District and our individual buildings, and make the decisions based on that. But I can tell you, any decision that I make, I know that somebody is going to be impacted negatively by it. And my desire is to have that one answer that everybody agrees with, but during these times, I just, unfortunately, that's not possible right now. Another question that I've had is summer school. And many of our students are struggling right now, whether they be in a virtual environment or face-to-face. But the reality is that this is not a normal mode of instruction. And so students that are struggling, will they have a chance to do something in summer school to make up? And absolutely. I think our summer school offerings are going to look very different than what they've looked like in the past, because I think we have more of our students that will be in need, even if they didn't necessarily fail a class, but we just need remediation and reinforcement to help students be ready for the following year. We certainly will be putting out programs to be able to assist with that, and hopefully by this summer with a lot less restrictions on us than what we've currently had. Other questions that I've had, again, when will people know if they've been switched to the virtual academy or face-to-face? You've already been contacted by your schools, making sure that you want to continue to stay with that selection that you made when you had a chance to change, and then they will be contacting you about new schedules as we get closer to the end of the semester. So that is in the works. This is a very good question that's come up over the past week, and the question is regards to high school end of course testing and virtual students that are having to start face-to-face end of course testing. So let me explain what has happened with end of course testing. The State Department has mandated that all end of course testing be given in person. It cannot be given virtual or electronically. So every student in our school district that has to take an end of course state test, which, again, English 2, algebra, biology, and U.S. history, every one of those students has to take that in a face-to-face classroom. And so we've had to put schedules together to accommodate our virtual students and our face-to-face students. The good news is that there's nobody in our buildings right now this week. So it made sense to put our virtual academy students in face-to-face in our buildings now, because there's nobody else in our buildings and there's no other students that they have to be around other than their own peers. And we feel like we can spread out and be at least 6 feet, if not farther, away from each other. We can use multiple classrooms that we would not have access to if we were in school right now face-to-face. And so the reason that we are bringing in our virtual academy students this week is because all of our face-to-face students have to take end of course starting next week. And so we don't have an option in that. we have to give end of course to all of our students in the school district in a face-to-face format. And so again, it made sense that the virtual academy students would test first because our buildings are empty, and we know that many of those students need to have that extra space and not be around. Need to be around as few as people as possible. And then of course our regular face-to-face students that are in AB schedules right now, they also have to take that end of course face-to-face, and we've put those schedules together. So that information has been delivered to you through your schools. Again, if you have any questions specifically, contact your schools, contact your teachers, contact your principals, and we will make sure to get that taken care of. But just know that our plans that we're putting in place for our virtual academy students to be face-to-face taking an end of course is that we are putting very large spaces into play so we can have people spread. And as soon as the test is over, those students are able to leave the building. So in general, we're looking anywhere between 2 to 3 hours for those students to be in buildings together. But that was a very good question, and it's something that we just received guidance from the State Department on in the past 2 weeks. We had been asking, and they finally made a decision that we would have to teach, we would have to give those tests and assessments face-to-face. Also, again, just working through some of the different things. One of the questions, please keep working parents in mind as we make decisions. I promise you we are. I know how difficult it is to have to make plans for your children other than what you're used to doing. And if I can at all possible keep us in school to where you don't have to worry about that, I am trying to do that. But I understand that you need time to react to it, and I'm hoping that when we give you our decisions that there is enough time for you to react to it. But again, I apologize if there's not. It's not our intent. We are not at all trying to create hardship for you. We're actually trying to help you by waiting to make sure if there's any way we can keep students in the buildings so you don't have to worry about child care, that we're doing that. But we will absolutely continue to work on that for you. Well, it is 12:58, and that wraps up all of our questions. It's great being with you for the first time in a while on Facebook Live and have a chance to talk through some of these things. I hope this has helped. Again, I'm not asking for all of us to unanimously agree with what I'm saying today. I'm not asking for us to unanimously agree with each other online. But what I am asking is that let's be respectful towards each other, that we all can agree there are no easy answers. And there's more than one right answers a lot of times right now. And just know from my perspective, I'm going to do everything I possibly can to keep you and your families, employees, teachers, students, community, to keep you all safe, but at the same time, for society purposes, keep our students being educated as well. Society is open right now, and nothing has changed that. And so I have to balance, how do we take care of everybody? And there's no right answer. And so all I can tell you is the Darlington County School District answer today, at this moment. I can let you know what that is, and we will continue to update as we work through this. Again, I'm going to try to come back to you on Facebook. I realize that it's good to be able to have time to give information out like this. I hope this is helpful. We'll certainly let you know in advance when we're going to do this in the next week or so. We'll gather questions from you. And I hope I've got a lot better news for you. Please, please, please stay safe. Wear a mask. Stay 6 feet away from people. Wash your hands as much as you can. And listen, for those families that have been affected by COVID, and we have more and more of them in our school district, my prayers are for you and for the health of your families, and for just for those that are sick to get better, and for those families that have suffered over loss because of this. Again, my heart goes out to you. and just know that we're thinking about you, and that we absolutely want everybody to stay safe. Hug a family member. Be thankful for what you have. Let them know how much you love them, because there's very few things we can take for granted. And right now, family and loved ones are a good op there. So please let everybody know how much you care. Take care of your neighbors from a safe distance. And again, let's be kind towards each other. And let's find the joy. It's so easy to see the negative, but let's find the joy. Y'all have a great rest of the week. I'll be in touch soon.